Hello and welcome. This is our Talk to Addis program. I am your host, Abdullah Brahani. Today, I just have brought you an honorable guest to our program. Our guest is Dr. Abu Bakr Campo, UNICEF representative to Ethiopia. He is by profession a medical surgeon. Do stay with us. Now, let's move to the successful initiatives or stories that UNICEF has implemented recently in Ethiopia. Let's talk about that. Tell us about that, Doctor.
I mean, there are many of them. I think there are many of them. I think
Very impactful.
very impactful. I mean, water and sanitation is one of the impactful.
Yeah.
When you bring in water into a community, it's life-changing. In particular, if you see some of the installations. So let's talk about, for example, the water project in Itang, Gambela, where we have more than 500,000 refugees from South Sudan, where we have implemented the program in providing water for the refugee community as well for the host community. And this project has now been finalized, so we are providing water for over 400,000 people, which is within a reticulating systems. So it's not just for the refugees, but also for the host communities. And today, this project is managed not anymore by UNICEF, so the water, it's the Water Bureau in Gambela, who is basically managing the facility. Everybody is paying for the provisions of receiving water, whether it's the host community or whether it's the refugee, which is a very sustainable program. It's not just so we're not tracking water bringing here. So even when the refugees will be going back home, whenever this will be, these water systems will be in place with the capacity of providing water in different areas. So it's very, very successful. When we look at our health programs, we have mobile health clinics, mobile health and nutrition teams in the Afar regions and Somali regions, as well as in some of the hard-to-reach areas in different regions. What do those mobile health and nutrition teams do? In Afar, in particular, where you have quite a large number of pastoral communities who move, they don't visit these static facilities, but they're still citizens of this country, and they still need to get health care. So those mobile teams are equipped with a car, with medicines, with equipment, and they move every single week to different points in the areas where we don't have health services. And communities communicate among themselves and know exactly where those points are, and they provide services there. It's quite costly, but it's a very simple mechanisms of outreach services to provide health services within the communities. Very successful program. So we have about 30 mobile health and nutrition teams which provide health services and nutrition services at the same time. Now, is 30 enough for a region like Afar? Definitely not. But it is not insignificant either, because they actually see more people. They see more patients. Actually, those mobile health and nutrition teams see more patients than the static facilities in the regions as well. So we consider this as a quite successful program as well. Community initiatives, where we are building ties with communities so that they also become more self-reliant in a certain way. The flooding, when we talk about the flooding response, which we did in the Somali regions, very successful. Now, we could not stop the flooding, but we at least responded, to those emergencies as well. Now, the next step for us should be, when it comes to natural disasters, can we mitigate flooding? We in UNICEF, we believe we can. But then we need absolutely more resources for that, and we need stability and peace, because some of these mitigation measures needs long-term development activities. How can we mitigate on flooding? It's basically just create artificial lakes where water can be diverted so that the rivers do not overbound certain areas. But it needs very, very strong investments for the future. But these are the kind of things which we are discussing. And having those discussions with government, I do see this also in terms of success. I would like to say that the entire response, in particular for Tigray, during the difficult times, I see this as a very strength of UNICEF. UNICEF was one of the agencies who did not leave Tigray during the war. We were there before the war, we were there during the war, and we were there after the war. We were present, and we gave relief services, whether it's in terms of shelters, whether it's in terms of health, whether it's in terms of nutrition, whether it's in terms of protections and education, as best as we could in the particular situation. I see this as a commitment of UNICEF staff to deliver and stand by the Ethiopian people there. And it's the same thing what we're doing today in the Amhara region. It's the same thing what we're doing in the Oromo region. So, when it comes to successes, there are quite a number. Did we serve everyone? Definitely not. Have we gotten it every time right? Definitely not. But definitely, one of the things that I'm sure is that all UNICEF staff who works, whether it's international or national staff who has been working in Ethiopia, has been giving their best to make sure that we can alleviate, at least for some, and at least in those areas where we are present, to make sure that we can contribute to alleviate the suffering of people because of those consequences of crisis. And in areas where development was possible, we have contributed for development as well.
So how does UNICEF measure the impact of its programs in the region, I could say in East Africa as a whole, or in Ethiopia particularly?
Sure.
Do you have, what you call program manipulation or program evaluation schemes?
Yes,
and do you do such kind of things? So what are the measurements and are they really to the point, updated?
No. I mean, we have indicators for sure.
Yeah.
And every country office is measured by their indicators. When it comes to health, we look at mortality, we look at morbidity for children under 5, children over 5. Maternal mortality is probably one of the best indicators. So we do, for every single programs, we do have measurements. Our programs are evaluated.
The range of your success.
Well, I think our programs are successful. But I would say at the same time, when we still have more than 12 million children out of school, it is a problem. But does it mean that UNICEF did not work? That's not what I mean. I think, as I mentioned before, until we really address the societal tensions within communities, progress will be slow in a certain way. When you have a country with about over 4 million people displaced, internally displaced, it's an issue. And it comes with consequences which sometimes are difficult to address. It is also good to mention, despite the internal issues which Ethiopia still remains a very generous country because they have opened their doors for citizens from other countries to come in, which have probably more problems in their country than here. So we have more than 1 million refugees in Ethiopia as well. So all these different elements contribute to a certain dilemma. So yes, it is a little bit paradoxal, and UNICEF will not be resting on their laurels until we have access to health to every single child, until every child is back into school, until we have no violence committed against children anymore. So until these phenomena exist within society, the job of UNICEF is not done. But this does not mean that we have not been very successful in certain ways. Can UNICEF do better? For sure, UNICEF can do better. And I think we're striving on a day-to-day basis to do better. But coming back to your questions of how UNICEF is evaluating ourselves. So we do have evaluations done on our programs. And we look at them so that we can see where we are still lacking and where we can improve, and things which are working very well and which we should be doing more. But our best evaluator is the community itself. So we have also community feedback. And community are appreciating, that where no services has been there for many, many years, and now suddenly you have lights. When it comes to immunization, for example, it is because of the conflict now that we're seeing a lot of measles outbreaks. But in the past, measles outbreaks were very limited. Now we have cholera outbreaks, which was something which was very localized at the beginning, but now it is all over places. But these are consequences of the issues which I've mentioned before. It hasn't gone out of hands because of the work which UNICEF does with the government. I want to emphasize, it is not UNICEF works alone. We work in support of government. What made it possible for us to be successful is when we are joining up with other partners in government as well. So it's not just a UNICEF support, because as I mentioned, our mandate is big and we cannot do everything, and we have to have other partners helping us. Yes. But we are definitely catalytic enough, to join hands with government to address. So yes, I think to a large extent, I want to believe that UNICEF has been an important player to address some of the challenges of Ethiopia, but I don't think it has been enough to create an environment where we can yet say that we are serving all the children of Ethiopia, because we are not sufficient present everywhere. And I think there are still too many contentious points within the society, which makes progress not as fast as it could be.
How does UNICEF collaborate with local governments, NGOs, and other stakeholders in Ethiopia? Let's talk about those partnering companies or organizations that you are doing with.
I also think we can do better, and we should be doing better and more as UNICEF, in particular with local NGOs and local governments, because it's also about sustainability. And I think the aim of UNICEF should be to make sure that in 50 years we don't need UNICEF in Ethiopia anymore. This should be the aim. I'm saying 50 years, but it could be even 20 years or 30 years. The sooner the better. And when UNICEF is not present, then it means that, or when UNICEF is not needed anymore, let me put it this way. If UNICEF is not needed anymore, then it means that the life of children has very glorious days. And that's what we should be aiming for in a certain way. So for us, the whole sense of localizations in terms of our programs, involving local partners in particular, is extremely important, and government, it's extremely important, so that things can be carried out on their own. But there are challenges with that, because at the same time, UNICEF is a very responsible organization who has accountability dear at their heart. And sometimes it is difficult with some of the local NGOs because UNICEF has a very stringent accountability mechanisms, which could be very heavy on some of the local partners. But this is the price to pay for sustainability. And I think UNICEF will be looking to more and more of helping local NGOs of taking the lead in some of the programs that we basically do.
Are there any new partnerships or initiatives that UNICEF is doing right now or focusing on to address on some specific issue? For example, I know previously, maybe you might touch it. You work with Addis Ababa State Administration along with ECD. So this is a newly induced program. So let's talk about those things.
Yes.
And how do you see the initiative, by the way? How is this progressing? Are you really trying to monitor the progress?
Sure.
And it's, I know that there has been some feasibility study and curriculum design as well. So How effective is the progress? Let's talk about that.
You're right. I think we have a couple of new initiatives. Let me start with the one which we have with Her Excellency Mrs. Addis Abeba, the mayor of Addis Ababa City Administration, of Addis Ababa City. We love the vision of Her Excellency in wanting to make Addis Ababa in 2035 the city of excellence, where everyone can optimally raise their children. It's a wonderful one. And I think we can see some of the initiatives with closing some of the roads on Sundays so that physical activity is feasible in a city like Addis Ababa, where we don't have yet a lot of playgrounds, where there's a visions of having more than a couple of thousand playgrounds around the cities where children can play, which is part of early childhood development, the ECD program in itself, where a number of kindergartens have been basically created as well, and so, but also where she has built institutions to bring street children as well as women who are living in the streets and can get an education or training so that they can be removed from the streets and have income generating activities which allows them to live decently somewhere. So this is exactly within the spirit of that. So one of the new initiatives which we had is to support exactly what Her Excellency wants to do in Addis. And in UNICEF, we want to join as well sports with early childhood development. I think personally that UNICEF has not yet tapped into sports as much as they could have, or even in arts and culture as they could have. And I think these are powerful industries who could occupy quite a large number of young people to move forward. As I mentioned before, the school is an institution, but the sports industry could be in another institution as well. So would be, arts and culture as well. So in this sense, we have been joining with the city administration. We have signed an MOU to support some of the daycare clinics. And I think the daycare institutions is also a tool which helps women to get more empowered. If children are staying at home in urban settings, it means somebody has to take care of them, which takes away now time for women to do other maybe income generating activities. So it's a good thing for us to do. But daycares also can serve, to give the child the necessary stimulations in early life to grow, intellectually and mentally and physically as well, where also good nutrition can be provided. So the agreement with the city administration is that we will support the constructions of a couple of daycares, but also we will have a sports center where we will utilize sports and nutrition provided to communities which are less fortunate than others in the same sense. But it's in the same vein. So the program as it stands right now is still quite small, but we hope that other UN agencies will pick up and do exactly the same thing as we're doing, so that we have a snowballing effect in critical mass of these kind of institutions where children can be taken care of, whether it's actively in terms of doing sports. And we also know the contributions of sports to early childhood development in itself, which is much more fun than just being too academic in daycare or having it. So it's really introducing the play philosophy, whether it's through sportive activities or art and culture, within a society which is quite busy in reconstructing themselves in a certain way. So this is where will be our contribution, and this is a bit innovative also for UNICEF, because we never have been making the link as strongly in certain sense. We also feel that the more we get involved in sports, we can create employment for young people, which is extremely important for the young generations as well. I mean, Africa as a continent is far behind than Europe, for example, because if you look at the sports industry of how many people they're actually employing, it is not insignificant at all. And I think we need to start developing other employment streams than just doctors, teachers, militaries, lawyers, administrators. You know, it's very small. While the sport is, we have a lot of more people who can be employed, like gardeners, maintenance people, masseurs and masseurs, therapists. You know, there are quite a large number of employment opportunities which can be created as well, which is also contributing ultimately to stability and peace. And this is why, for us, these connections, wherever we start, and being catalytic is important for us as an initiative. One of the other initiatives which we're doing right now is, as I mentioned before, behavior change is extremely important. If you want to bring people to sport, it's important. But we also need to reduce poverty, and this is where the employment is great. But in terms of behavior change, we also feel that the entertainment industry, like movies, the dramas, and so on and so forth, has also not yet been utilized. And they are powerful communicators. In UNICEF, we always thought that we are good in behavior change, and we have a good communication departments. But personally, I believe that the entertainment industry is a much more powerful communicator. Media has the way of changing behaviors or influencing behaviors in a different way than what we're doing, you know, in agencies like from the United Nations or in NGOs. And there should be room for us to collaborate for them. So one of the new initiatives that we have right now is that we have given certain behaviors which we want for us to change to the entertainment industry and let them do a drama out so that they can talk about it in their terms. And then we will start measuring, does this lead to positive behavior change or not? Which is also new for us, so we're taking a number of risks as well. The other initiatives where we are quite keenly trying to move forward is on climate change. We cannot ignore climate change anymore. So we will have to push these days of making sure that everybody gets familiar with solar energy. Everybody gets familiar in terms of how do we address waste management. If you see the plastic pollutions just here in Addis, it is horrendous. And yet, what do we do with those plastics as well? But all these different elements does not just serve our purpose of behavior change, it should also serve in creating job opportunities in these particular areas. When it comes to green energy, it will create employment. So we need to make it much more present within our programs as well. When it comes to waste management, plastics, recycling, it's a new areas as well. So we can create a lot of employment in this area as well. Decent jobs. So yes, you can see that UNICEF is normally the agency for children, but we think a little bit differently because poverty is another big challenge to address issues for children. In a poor household, the behavior is completely different than in a much more fortunate household as well. So our program should not be just addressing directly the issues, but also should be serving of creating employment opportunities, innovation opportunities, you know, to make the society better.